Did you know more and more women are considering labiaplasty?
No, I didn't. Why is this happening?
Young girls are being told their bodies are wrong, often before they even understand how they work. This isn't just about cosmetic surgery. This is about shame, misinformation, and the price of impossible beauty standards.
That's awful. How do you know about this?
Well, I have done research into the topic. I am not a medical professional, but I am very passionate about women's health and developing a positive self-image and body positivity.
So what is the reality? What is actually happening to cause this rise?
Young women are expressing discomfort, insecurity, or a desire for labiaplasty. As a result, surgeons are reporting increasing requests. Some of these requests are even coming from parents. Labiaplasty is becoming increasingly popular. However, the motivations behind why can be considered controversial. Some motivations are simply aesthetic, and sometimes it's because of a physical problem, but it can be both. As you can see here, the International Society of Aesthetic Plastic Surgeons has stated that 189,058 labiaplasty procedures were performed worldwide in 2023. This is over a 65% increase since 2013. Labiaplasty is often offered as a corrective procedure for labial hypertrophy, which refers to the enlargement or asymmetry of the labia or the folds of skin surrounding the vaginal opening. This is a controversial subject, with some stating there should be a size threshold for this diagnosis, while others believe that any request is acceptable as long as it is generating a concern in the patient. This concern can be because of physical discomfort, psychological problems, or for purely aesthetic reasons. This often means the surgery is offered on demand and later justified by the patient's verbal reports of physical and psychological difficulties without any formal assessment of the problem. These verbal complaints can include discomfort while sitting or exercising, difficulty wearing underwear or tight pants, chronic infections, hygiene issues during menstruation, psychological distress, sexual difficulties, dissatisfaction with appearance, mockery from others, or concerns from parents. As a result, more and more women are requesting this procedure simply because they are dissatisfied with the appearance of their genitals rather than because of functional complaints. Many women who request this procedure have a distorted view of their body. The three main reasons for the procedure seem to be functional, aesthetic, or psychological. Functional reasons can include physical discomfort. This discomfort can interfere with daily life. Things like itching, pain during intimate activities, difficulty reaching orgasm due to labia minora inversion, discomfort while exercising, irritation or chafing when wearing tight clothing, UTI, deviations in the urinary stream, and hygiene difficulties. Aesthetic reasons stem from a desire to enhance the appearance of the genitals to conform to society's beauty ideals. Surgeons often reinforce this ideal that the clitoral hood and labia minora should be small, symmetrical, and concealed with the labia majora. This is often called the Barbie look. Psychological reasons focus more on the emotional impact of genital self-perception. This includes feelings of insecurity, shame, anxiety, and emotional distress. The most common psychological reasons are low confidence and self-esteem, social insecurity, shame, or insecurity with intimate partners. These reasons, while valid, can pose ethical challenges. There is a medical ethical principle of autonomy that requires patients to make decisions free from psychological coercion. This requirement may be compromised in these cases. The medical profession has a duty to ensure that consent to medical treatments are valid. This means that their decision is uninfluenced by external pressures and no psychological disorders are interfering with their choice. If body dysmorphia influences the desire for the procedure, the validity of their consent could be called into question. Some people believe that cosmetic surgery may be a reasonable choice in some situations. On the other hand, some others wonder if such a choice can ever truly be made freely. The problem is when women make choices to try to fit into a social or cultural norm over doing what makes them feel good or just being themselves. Social media, porn, and silence around vulva diversity are all a part of this pressure.
Social media seems to cause a lot of problems.
Well, it can be good when used in moderation and responsibly. However, one big problem with social media is that it often only shows us idealized and unrealistic images and beauty standards. These curated images can create an unattainable ideal, which creates problems when people start to compare themselves to these images. Comparison is a huge problem in social media. The major problem with comparison is most of us tend to compare ourselves in a negative light, and this can lead to body dissatisfaction. This body dissatisfaction can then lead to a desire to change ourselves to fit the images we see. That being said, social media isn't the only issue. Pornography shows us altered vulvas, whether through editing or surgery. This presents a narrow and unrealistic portrayal of what is normal. This can cause young people to believe that these altered images are the norm. When they believe this and their own bodies don't match, they may begin to feel ashamed even though their variation is most likely completely normal.
I feel like this should be talked about more.
That's another problem. There is a lack of open and honest conversations about the natural diversity of vulva shapes, sizes, and appearances. This lack of transparency makes it seem like something that should be kept secret, or worse, something we should be ashamed of. When we don't have accurate information and positive representation of these differences, young girls are likely to internalize the unrealistic ideals they see in social media and porn, which can lead to insecurity and shame. As a person of the female persuasion, I do understand this is a touchy subject because it is already so hard to get medical professionals to listen to women about their own bodies as it is. This makes it hard to say that this should be assessed more, but in this case, I do believe that needs to happen, or at the very least, there needs to be more education about what is normal. This discussion needs to happen so women can understand their bodies better and understand that they are not broken and don't need fixing.
Wow. Can you tell me why this is happening?
Well, the desire for labiaplasty is a combination of both psychological and physical issues. Psychologically, it deals with aesthetics and the dissatisfaction with the appearance of the labia or anxiety that their partner will not like it. Physical issues usually deal more with physical discomfort. Whatever the reason, women of all ages and from all walks of life are starting to express a desire for the procedure.
You mentioned unrealistic standards. Can you tell me more about that?
Sure. Most vulvas shown in media are edited, filtered, or surgically altered. This is true even in sex education.
Wow, that's crazy.
Right. And comparing oneself to these images can lead to a feeling of not being normal, and this can lead to low self-esteem and confidence, which is one of the main reasons for women requesting this procedure.
I imagine feeling like your body isn't normal can make you feel quite uncomfortable.
Exactly. However, it is important to note that defining what is normal can be tricky business as it changes from person to person and from culture to culture. My high school therapist used to tell me that normal was just a setting on the washing machine. That being said, in cases where their labia is causing physical discomfort, labiaplasty may have its purpose.
How has social media contributed to these unrealistic standards?
It promotes narrow definitions of what is normal or desirable. This leads to body dissatisfaction because of the desire to reach this unattainable ideal. This ideal has already been shown to create mental health disorders and eating disorders in some individuals.
But beauty comes in many forms and shouldn't be limited to these curated and filtered images we see.
I agree. That is why it is important to embrace diversity and continue to promote positivity to counteract these standards and the negative impact they have.
There seems to be a lack of education around this topic.
That is because there is. Women aren't being taught that labias come in all shapes, sizes, and colors. As you can see, the lack of diversity in education is believed to have contributed to the increase in labiaplasty over the last decade. The lack of education and exposure to natural diversity is leading to body images issues, increasing anxiety, and an increasing desire for plastic surgery in general. Education in this area is important for so many reasons. Education would increase body positivity because women would understand there are natural variations. This understanding would allow them to learn to accept and love their bodies and feel comfortable in their own skin. Education about this diversity would help dispel these myths about the appearance of the labia, including the myth that sexual activity alters its shape.
What role does porn play in all this?
Many images in porn are censored or idealized for a neat or barely there look. Porn and social media are driving the rise in desire for body surgeries. This is because the images we see often distort our perceptions of how we should look.
I can see where that might be a problem. All this silence around the topic probably doesn't help either.
You are right. Silence creates a lot of shame. When we don't talk about anatomy openly, young women and girls begin to think they are the only ones who look different.
I feel like this isn't really a problem that men experience.
Well, men experience pressures as well, just in different ways. For example, the way we treat men's bodies and women's bodies are very different. Men can go outside topless with his nipples exposed, but if a woman's nipples are exposed, it is considered indecent exposure.
Yeah, why is that?
Women's nipples and pubic hair are often considered to be more pornographic than that of men's are, and as a result, they are more likely to be censored no matter the context. This includes posts about natural health issues.
That's crazy.
I agree. But women's bodies are often seen as sexual regardless of context. Because of this, even campaigns to raise awareness about breast cancer have been labeled as pornographic.
There shouldn't be anything sexual about breast cancer.
Exactly. In that moment, there is a real concern about a life-threatening disease.
This sounds like sexual objectification, which is not okay.
No, it is not. The sexualization of women, no matter the circumstance, is why some people today still view breastfeeding as a sexual act.
I still think that is ridiculous.
Me too, but this view is so dominant that the algorithms often do not recognize alternative reasons for talking about or showing a woman's body or even consider that it may be aimed at women. This lack of acknowledgement often helps create an issue where there isn't a place for women to learn about their bodies, thus increasing the lack of education and shame that we have around our bodies. Terms about women's bodies that are natural are often labeled as dirty and censored. However, by not talking about our bodies openly and learning what is actually normal and not just altered images, we increase the discomfort young girls feel about their bodies. We need to stop this cycle.
And I am sure purity culture doesn't help.
As a matter of fact, it doesn't. It tends to lead to an increase of shame when talking about these subjects, especially when it deals with female anatomy. It also doesn't help that sex education often doesn't describe the way a woman's body works in the most positive light, which can also increase this feeling of unease or dissatisfaction and shame.
This shame around the body seems to be a huge problem.
It is, and it occurs when we don't feel our body is meeting the norms or is undesirable. Women's bodies have been controlled for years in response to the male gaze, and it needs to stop.
I hear you, but what damage is really being done?
The damage is that young girls believe their bodies are ugly, wrong, or deformed. Women are experiencing shame around pleasure and identity. Not to mention the very real risk of trauma from unnecessary surgeries such as labiaplasty. Also, by doing nothing, we reinforce the harmful beauty narratives that say our bodies must be altered to be loved.
Okay, but what exactly needs to change?
We need to normalize vulva diversity in sex education, whether that be from the school or from parents. This will help promote positive body image, reduce shame, and help create an accurate understanding of human anatomy. Exposing individuals to diverse images and information about the natural variation in vulva appearance can counteract harmful ideals and help alleviate feelings of shame and anxiety. This is also true about the natural variations in bodies in general. Women should be empowered to embrace their unique bodies, not be pressured to conform to unrealistic standards. Using accurate terms will help young girls be able to communicate about their bodies in a healthy, unashamed way. Addressing these issues in education would help dispel myths and misconceptions that have been pushed by these unrealistic ideals. As a parent, I know this can be hard, especially when you have also held these harmful beliefs, but it is worth the work to not only heal yourself but stop from passing on the damage to our daughters. One thing that can help is to use the correct anatomical terms for body parts. Places like the Labia Library help depict the natural variation in vulva appearances. Schools can help by adopting a more comprehensive sex education curriculum that includes discussions of vulva diversity and body positivity. And as parents, we should encourage open and honest communication about bodies so our children have a safe space to ask about what is normal or feel like they can do the research for themselves without feeling shamed. We should also avoid negative self-talk about our own bodies and celebrate the diversity of bodies that exist so our children can grow up feeling good about themselves. As it currently stands, most young men and women don't realize that what they see in media is often not real. The conversation about what is normal often starts in sex education, which is exactly why we need more comprehensive education in this area. Currently, sex education fails to teach about body diversity and can actually perpetuate these unrealistic standards and the shame they cause. This education is important to help create healthy boundaries and for people to advocate for their own health and safety. Another thing we can do is shift language from shame to celebration. This means recognizing and challenging negative self-talk. Pay attention to the thoughts you have and the things that cause you distress or negative feelings and question them. Are these thoughts based on evidence or assumptions? Are they absolutely true? Are they kind or helpful? Our negative self-talk often will exaggerate reality. Replace these negative thoughts with more positive ones or counter them. It is important to remember to treat yourself kindly or like you would a friend. You would never talk to your friends the way you talk to yourself, and we should all work towards being our own best friend. Remember, everyone makes mistakes. They are a natural part of life and you can learn from them. They don't define us. It is okay not to be perfect. Everyone is worthy of love and acceptance, and always remember to celebrate your progress. Take pride in your effort, progress, and growth, even if it seems small. Acknowledge your dedication and don't let anyone tell you that you aren't doing enough. We can advocate for body positive and age appropriate media. This is crucial for fostering a healthy body image and good self-esteem.
How do we do that?
We start by combating the negative media influences that promote these unrealistic standards that are negatively impacting our youth. Body positivity helps people understand that all bodies are good and deserving of love and acceptance. By increasing body positivity, we will also enhance mental health by increasing self-esteem and confidence. You can do this by supporting creators who support diversity and body positivity. Choose media that features diverse body types and don't just adhere to stereotypes and social norms. Discuss media messages with your children and help them question the unrealistic standards they see. As a parent, it is also very important to be mindful of how you speak about your own body or the bodies of others, as your children will get a lot of ideas about their own bodies from how you talk about yours.
How do we empower girls and young women to understand and love their bodies before the world tells them not to?
Start by cultivating self-love and body positivity by promoting positive self-talk, celebrating body diversity, and encouraging self-care. Foster media literacy by teaching young girls to critically examine media portrayals of bodies and identify these unrealistic standards. Help them understand the pressures of social media to conform to unrealistic expectations and how to fight against this pressure. Create environments where girls feel comfortable discussing their feelings about their bodies and bodies in general. Normalize body changes by helping girls understand how their body will change throughout life and how it is a natural process. Period Power by Maisie Hill and In the Flow by Elisa Vitti are good resources for this. Finally, challenge stereotypes that impact body image and teach young girls to have healthy boundaries and empower them to stand up for themselves. And remember, your body is not wrong. Your labia is not wrong. You are not broken. The system that taught you to hate yourself is what is broken. You are not alone. And you do not need to be fixed to be beautiful.